Exercise is one of the most powerful and accessible tools for naturally managing cholesterol and protecting cardiovascular health. Regular aerobic activity, such as brisk walking, jogging, swimming, cycling, or dancing, has been consistently shown to raise HDL, good, cholesterol, lower LDL, bad, cholesterol, and reduce triglyceride levels. These changes don't just improve lab numbers, they translate into real reductions in heart attack and stroke risk. And unlike medications, exercise has no adverse side effects when done safely and in moderation, only benefits that ripple throughout nearly every system in the body. The most immediate and consistent effect of exercise on cholesterol is its ability to raise HDL. HDL plays a crucial role in removing excess cholesterol from the bloodstream and transporting it to the liver for excretion. Higher levels of HDL are associated with a lower risk of atherosclerosis, and studies show that even modest improvements in HDL levels through physical activity can lead to meaningful cardiovascular protection. This is one of the most reliable effects of aerobic exercise and is especially important for individuals who have low HDL despite normal or even high LDL. Exercise also lowers LDL cholesterol, although the effect here can be more modest and variable. The mechanism seems to be partly due to improved metabolism. Regular activity enhances the liver's ability to clear LDL particles from the bloodstream. More importantly, exercise helps shift LDL particles from small, dense forms, which are highly atherogenic, to larger, more buoyant particles, which are less likely to penetrate artery walls and cause plaque buildup. Even if total LDL doesn't change drastically, this shift in particle size is beneficial and represents a meaningful reduction in cardiovascular risk. Triglycerides, the fat molecules that rise after meals and with carbohydrate overconsumption, are particularly responsive to exercise. Regular aerobic activity can significantly lower fasting triglyceride levels, especially when combined with a reduction in sugary foods and refined carbohydrates. Lower triglycerides mean less fat floating in the bloodstream, reduced liver fat accumulation, and a lower likelihood of metabolic syndrome, a common precursor to both diabetes and heart disease. The benefits of exercise extend beyond direct cholesterol regulation. Physical activity improves insulin sensitivity, reduces inflammation, lowers blood pressure, supports weight loss, and enhances mood, all of which contribute indirectly to better lipid control. In people with abdominal obesity or metabolic syndrome, exercise alone can sometimes normalize cholesterol levels without the need for medication, provided that other lifestyle factors like diet and sleep are also addressed. However, the benefits of exercise depend heavily on consistency and duration. The American Heart Association recommends at least 150 minutes per week of moderate-intensity aerobic exercise, like brisk walking, or 75 minutes of vigorous activity, like running, plus 2 days of strength training. Sporadic workouts or short bursts of activity, while still helpful, are unlikely to produce the same cholesterol-lowering effects as a sustained, weekly routine. That said, the warning lies in assuming that exercise alone is enough. It's a mistake to think that a daily workout cancels out a diet high in saturated fat, processed foods, or sugar. Some people with high cholesterol continue to experience elevated levels despite regular physical activity, particularly if genetic factors are at play or if poor diet and alcohol intake continue to fuel lipid imbalances. In these cases, exercise is still essential, but it must be part of a larger lifestyle overhaul. Another pitfall is overtraining or pushing the body too hard without adequate rest. Excessive exercise can lead to stress, hormonal imbalances, and inflammation, all of which can paradoxically impair cholesterol control in the long term. As with any health intervention, balance is key. Consistency, variety, and recovery are what make exercise effective, not sheer intensity. In conclusion, regular aerobic exercise is one of the safest and most effective natural strategies for improving cholesterol levels and reducing cardiovascular risk. It raises protective HDL, lowers harmful triglycerides, and helps improve LDL quality, if not always quantity. But its full benefit is only realized when combined with healthy eating, weight control, stress reduction, and sleep. For people with high cholesterol, the message is clear. Exercise isn't optional. It's a cornerstone of long-term heart protection and one of the most powerful tools we have to fight silent, progressive cardiovascular disease.